Hello and welcome everyone. I'm Nuri from the Massachusetts Health Connector. I'm joined by my colleagues Elizabeth from MassHealth and Nikki from the Health Connector, who will be presenting today's information. Together, we are here today to share information about renewing your MassHealth coverage or obtaining coverage through the Health Connector right now. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, we just want to share some information about our presentation format. Everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes. Then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen. We will be monitoring your questions throughout. Please do not share any personal information or private health information when you ask your question, as others on the call are able to see what you write. If you have a personal scenario that you want to discuss with someone, we'll be providing contact information for MassHealth Customer Service and the Health Connector's Customer Service Center, and instructions on how to find help from a local assister. Also, we are recording today's webinar. Following today's session, you'll receive an email with the presentation, so there's no need to take detailed notes. So without further ado, I'll pass it on to my colleagues to start the presentation.
Thanks so much, Nuri. And again, thank you everyone for joining us this afternoon. I'm actually going to just pass the baton over to my colleague, Elizabeth, and she can kick us off.
Thanks so much. If you want to flip to the next slide here. So today for this member webinar, we're really focused on making sure folks understand that this year, MassHealth needs to renew coverage for all members and make sure that they're still eligible and can receive the best health coverage benefit that they qualify for. So through this webinar, we're going to talk about what members will need to do, what actions they will need to take this year to not only update their information, but also how to renew their health coverage. We also recognize that through this process, some individuals may find out that they no longer qualify for MassHealth. So Nikki from the Health Connector will talk about how individuals can get coverage through the Health Connector and how that may include getting help paying for it as well. So today we'll walk through what a MassHealth renewal is, why renewals are really important this year, share how you can prepare for the upcoming MassHealth renewals, what you should do when you get your renewal form, and also outline resources that are available to help you answer specific questions about the renewal process, how to take action, and where you can get help in your community as well. And then Nikki, of course, will talk about coverage through the Health Connector. So starting off, just to talk a little bit about the relationship between MassHealth and the Health Connector. If you want to flip to the wonderful, we wanted to share a little bit about what we mean when we say MassHealth. So MassHealth is Massachusetts Combined State Medicaid and CHIP program. And we provide health benefits and help paying for them for children, families, seniors, people with disabilities who live in Massachusetts and who qualify for MassHealth. Right now, we support 2.3 million members, which includes over 220,000 older adults and 300,000 individuals with disabilities. We also know that of our caseload, 2 in 3 of our members are individuals who are in low-income families. We support also 1 in 4 Massachusetts residents across the state and 2 in 5 children across all incomes throughout Massachusetts. We not only cover services comparable to commercial or private insurance, but we also cover services that traditionally aren't covered by other insurers, such as long-term services and supports or certain behavioral health services. And Nikki, I'll pass this to you.
Great, thanks so much. So again, just to give you context of how closely related we are, our organizations, how closely we work together, I want to talk a little bit about the Health Connector as our state's health insurance marketplace. So we have essentially been in place since 2006, and we are here to offer coverage for individuals, families, small employers who need access to affordable health insurance coverage. So you may be wondering, okay, who are these people exactly who are getting coverage through us? And it's really folks who don't have access to another source of health insurance. And today specifically, we're talking about people who are transitioning from MassHealth and who, they're no longer eligible and they aren't able to get health insurance through their current job or another source. And as Elizabeth said, a lot of people who qualify for Health Connector plans can get help paying for the coverage. And also some people do become eligible for $0 plans. So the plans are comprehensive, and we'll talk more about that later. And I'm always remiss if I don't mention that people can also buy dental insurance through the Health Connector. So with that, I'll hand it back to Elizabeth for the important details.
Wonderful. So one first off the bat we wanted to share was that right now there's one application for MassHealth, the Health Connector, in support and paying for health coverage for individuals who are younger than 65. And you can access this online at the mahealthconnector.org. And you can access a version of the site in Spanish at mahealthconnector.org/es/. So this is a great place to start to apply if you do not yet have MassHealth or Health Connector coverage.
And Elizabeth, just one thing I'd want to add here, and then I promise I will pass this completely back to you. Just noting importantly that if someone already has an account or if someone has already submitted an application, we really want to discourage people from creating a new account. So if someone is trying to log in and you can't remember your credentials or you had never logged in before, please reach out and someone from customer service can help you because I know there's a lot of complications when there are duplicate accounts.
Thanks, Nikki. So flipping to the next slide to talk a little bit about MassHealth Renewals. So I know we talk a lot about you're going to be renewed this year. We have to do renewals. And to kind of peel back the curtain a little bit, federal law requires MassHealth to regularly check whether members on MassHealth are still eligible. So this annual check is what we call a renewal. Sometimes folks might also call this an annual review. And these renewals must occur every year. Members will get their renewal form in the mail. They occur at the household level, and those renewal forms will be sent to the head of the household in a blue envelope. There are individuals, though, who may have their coverage automatically renewed. This means that we were able to look at the data we have on file for you and compare it against state and federal data sources to confirm that you're still eligible. In these scenarios, you won't have to take action, and you will be sent a white envelope letting you know that your coverage has been automatically renewed for the year. If we're not able to automatically renew you, then we will need additional information from you. In these scenarios, you'll get a renewal form in a blue envelope in the mail. And if you don't reply to that form in the blue envelope by the due date, you may lose your coverage. Flipping to the next slide. We're really focused on renewals this year because while this is a regular annual requirement, it's been a little bit different due to the COVID-19 public health emergency. Since February 2020, the federal government implemented continuous coverage requirements. And what this means is that individuals did not lose coverage during this time if they didn't respond to their renewal like they normally would. Those continuous coverage requirements ended on April 1st. At this time, MassHealth went back to our normal annual eligibility processes. In the next year, all members will be renewed by MassHealth to determine whether or that they still qualify for their current health coverage benefit. Some members will be automatically renewed, and some will get that blue envelope, which they need to respond to. These renewals are taking place over 12 months. So while they began in April of this year, they'll continue through the end of March in 2024. This means that you may get your blue envelope at any time during this 1-year period. So I mentioned earlier that some individuals will have their coverage automatically renewed. This is more likely to happen if you receive SSI through Social Security because you're 65 and older and have limited income or resources, or you receive SSI through Social Security because you have a disability and have limited income or resources, or you receive temporary assistance of needy families through DTA. You're involved with the Department of Children and Families, or you're a child and youth in custody of the Department of Youth Services. So these are some scenarios where individuals are more likely to be automatically renewed. The biggest takeaway, though, is if you receive that blue envelope with a renewal notice or any other mail that says you must take action for MassHealth, make sure to respond and follow the instructions to receive the best benefit that you're eligible for. So on April 1st, we returned to standard eligibility rules. And what we mean when we say this is 2 things. 1, we started this process to renew everyone. We began sending out those blue envelopes that you need to respond to, and that process will continue for the full year. And 2, as of April 1st, if you shared information with us, such as you now have a new job and you're making more money, this could cause your benefits to change for your household. So if you share that information with us online in your account, or through another means, that could change your eligibility for your type of MassHealth coverage. In general, you can always call MassHealth at the number on the screen to update your contact information without impacting your eligibility. So when we talk about this being a year-long process, a lot of folks want to know, what should I be doing now? How do I prepare for this? And the most important thing you can do right now is calling MassHealth to update your contact information. We recognize that a lot of folks might have moved since February 2020, maybe to a new apartment, maybe to a new city. Maybe your email's changed or you have a different phone number. And making sure that we have your latest address, phone number, and email will make sure that we're able to get in touch with you when you're selected for renewal and need to respond. The second important action to take in advance is to make sure you're opening and reading all your mail. That blue envelope will have your renewal form, but there will be other important notices that come from MassHealth in a white envelope. This can include confirmation that you've been auto-renewed, but also can include RFIs or requests for information that can also affect your coverage. So make sure you're opening all mail that looks like it could be from MassHealth or the state of Massachusetts. This is that infamous blue envelope I was talking about. It is a larger envelope and it's this bright blue color. So this is the envelope that your renewal form will come in. But as I stated, there is other mail that will also come from MassHealth that you should still open and read. In terms of how to complete your renewal, it differs a little bit depending on your age and your type of coverage. So individuals that are under 65 years old can go to mahicks.org/individual to provide the information we need and complete your renewal. You can also update the paper-based form that's sent to you in that blue envelope and mail it back to the address on the screen. You can call our customer service center and complete your application over the phone, or you can schedule an appointment with a MassHealth representative. You can schedule that appointment online, and that's for a phone or a virtual appointment. You can also visit a MassHealth enrollment center to get help in person. For individuals who are older than 65 years old residing in the community or of any age receiving nursing facility care or in a home and community-based waiver, you have similar but slightly different options to complete your renewal. If your renewal notice has an e-submission number, you can submit your renewal online at the website on the screen. You also, similar to the other group, can complete the application on paper and mail it back to the enrollment center. You can call MassHealth customer service for support, or you can schedule an appointment with a MassHealth representative for online or over the phone support, or walk into a MassHealth enrollment center. All individuals will have 45 calendar days to complete their renewal and return it back to MassHealth. There are a lot of resources to exist that help you. So if you get that blue envelope and you have questions, or you feel a little bit overwhelmed, or you know people in your family or community who need help, these are some great resources to share with them. The first is we have 7 MassHealth enrollment centers across the state. And these are places where you can either schedule a phone or virtual appointments, or you can walk in for in-person help with your application. These folks are MassHealth staff and employees who are experts at completing these applications and can make sure that you complete this in time. The second option is there are certified application counselors, we call them CACs, or navigators who are in your community and have been trained by MassHealth in the connector to help members apply for or renew their health insurance benefits. This is a really great opportunity if you maybe don't live near a MassHealth enrollment center, or there is a CAC employed by maybe a community health center that you work with who can help you. Help from CACs and navigators is always free, but at times it can require an appointment. At the address on the page, you can search by where you live to find a CAC or navigator in your area who can help you. And of course, you can always call MassHealth customer service for help. The phone number's on the screen. Our contact center is open from 8 a.m. to 5 p.m. We have assistance available in English, Spanish, Portuguese, Mandarin, Vietnamese, Arabic, Haitian Creole, and we also have a translator phone line where in almost any language we can provide that support and language access that you may need. In terms of what the process looks like for a renewal, when it's your turn to be selected, whenever possible, we will first try to automatically renew your coverage. If we're not able to do that, then we will send you a blue envelope in the mail, and then you will have 45 days to respond. If you respond, but we still need more information from you, we'll send you a request for information, or RFI. That will come in a white envelope, and you'll have 90 days to respond to that. Not everyone will get an RFI, but if we need more information, make sure you're on the lookout for that. If you don't respond to your renewal, or if you respond and are no longer eligible, you'll receive a termination notice from MassHealth. This lets you know that in 14 days, you will no longer have health coverage benefits. And during this time, if you receive that termination notice because you didn't respond to your renewal form, you can contact MassHealth, complete your renewal application, and assuming you're still eligible, have your coverage reinstated back to the date that they were closed, as long as you reach out to MassHealth within 90 days or about 3 months of your coverage ending. It's also important to note that if you haven't received that blue envelope yet, but you would like to initiate a redetermination by providing your updated eligibility information, you can. This does mean your coverage may stay the same, increase, decrease, or end. If you would like to be redetermined ahead of schedule, if you'd like to start that process, you can reach out to MassHealth or do so online by providing all of that information. If you go through that process and are still eligible, this will reset that annual review clock. So about 12 months from the date that you're redetermined next year, you'll be ready to go through this process again. And again, you can always update your contact information just by calling MassHealth. There are also additional language and translation supports available for your communities where you live or places where you work if you'd like to share. So we have a member-facing toolkit in 9 languages, which includes flyers, posters, social media messaging. We've also been working closely with Healthcare for All to do local language TV and radio ads explaining that the renewals are happening, that you need to act now to stay covered. We're also working closely with community-based organizations across the state who are holding events in their communities to support members and particularly support individuals who are immigrants or refugees. We've also published blogs or video blogs that incorporate American Sign Language, and we've offered live American Sign Language during webinars that have been recorded and are available on our website. The renewal forms themselves will be mailed in English or Spanish and are available in large print or Braille. For members who require translation, you can always call our contact center and we can provide those translation services live on the phone at no cost. As I mentioned before, our contact center includes a number of language supports where you can request a translator for the language that you prefer or need. We're also in the process of publishing a list of certified application counselor or CAC organizations who speak different languages. And we're also hosting enrollment events with on-site translators. Sorry about that, talking too much. And last but not least, we also offer on-demand VRI to support individuals who speak American Sign Language. Even if you think you are likely no longer eligible for MassHealth, you should certainly still complete your renewal form. It will help MassHealth determine if there are other affordable healthcare options for you, such as the Health Connector. I won't go into that as Nikki will be talking more about that, but I also will flag that for members who are over 65, there are additional affordable coverage options available. Some may be eligible for connector coverage if they do not qualify for Medicare. Other individuals may qualify for the Medicare Savings Program, MSP, or they also may be qualified for the Frail Elder Waiver, the Program of All-Inclusive Care for the Elderly, Prescription Advantage, and other programs or services run through Aging Service Access Points or ASAPs across the state. There's also a really great detailed resource available online called the MassHealth Renewal Help Guide, which really goes into a lot more detail about how this process works and frequently asked questions. And you can also visit our website, mass.gov/masshealthrenew. This will give you the links to update your information, start your renewal, and look at other resources available. Final tips before I hand it back to Nikki. If you're under 65, the fastest way to renew your coverage is online through your MA login account at www.mahicks.org/individual. If you're over 65 or in a nursing facility or home and community-based waiver, you can find information about the best way to renew your coverage by visiting mass.gov/masshealthsaka. Make sure to call MassHealth if you've moved, have a new phone or email address, so we can get in touch with you when it's your time to renew. And make sure you're on the lookout until April 2024 for that blue envelope. And make sure you're using the resources available in your community, whether that's the Enrollment Center, the Customer Service Center, CACs, or navigators. We're here to help, and we want to make sure that you maintain the best coverage that you qualify for. And with that, I'll hand it off to Nikki.
Thanks so much, Elizabeth. So as Elizabeth mentioned, there could be people who find out after they go through the renewal process that they no longer qualify for MassHealth. And we want to just describe a little bit how somebody could in fact get health or end dental coverage through the Health Connector. So the first thing that's important to mention is that if somebody loses access to MassHealth coverage, it is considered a qualifying life event. And basically that lets someone either enroll in or change their health insurance plan outside of our annual open enrollment period. So in a regular year, the Health Connector has an open enrollment period that begins November 1st and it usually ends around January. Now, regardless of when somebody loses their MassHealth coverage, because it is a qualifying event, this gives them that opportunity to come in and get coverage as they need it. Now, there are other life events that would let someone qualify. So things like changes in household size, somebody's income going up or down, an update to immigration status, or even a move into Massachusetts, or a move from one area of Massachusetts to another. So we have a complete list of qualifying events on our website, but I think the most important thing to note is that if someone loses access to MassHealth coverage, they can certainly, it is considered a qualifying life event. Now, what's really important is that if anyone has any type of qualifying life event, they report it as soon as possible. And as someone is going through their updates and selecting a new plan and enrolling in a plan, if there are any payments that are due, all payment and enrollment deadlines still apply during a special enrollment period. Now, you might be wondering, okay, well, what if somebody, someone has access to coverage through a job now? What happens if, somebody was currently, or somebody had been protected in MassHealth coverage, got a position, etc. So I think it's really important to just note that if somebody is working and you have access to employer-sponsored insurance, you may not need coverage through the Health Connector. So what we're encouraging you to do, and we're also speaking to Massachusetts employers about this, is reach out to your HR person, reach out to the benefits department, and find out, are you a benefits eligible employee? Are you able to get coverage for you and your family through the company that you're working for? Now, when you are updating your application, you're going to be asked some really detailed questions about your coverage. So I think you'd want to find out the cost of those plans, how much you as the employee are going to need to contribute, and then also, of course, find out when you need to make a final decision for your employer's coverage so you can enroll in their health insurance. Now, I started to mention this. People who have access to affordable coverage through an employer are not eligible for financial help through the Health Connector. But you may be in a position where you're thinking, okay, I have this employer-sponsored insurance, and it doesn't seem affordable to me. So what we would need you to do is, again, go back to your application. Health Connector coverage may be eligible. You may be eligible for that. You may be able to get coverage with us. And it really all depends on the state's affordability standards. So this is why you're going to need that detailed information about the plan offerings, the costs of those plans. And all of these questions are part of our paper application as well as the online application. And all of the responses that you provide really just help the system determine if you and your family are eligible for savings through the Health Connector. Now, just hopefully something that gives you all a peace of mind as you're going through this process. If you find that you're now eligible for a Health Connector plan, I think it's important to note that all the plans that are sold through the Health Connector meet state and federal standards for coverage. So what does that mean to you as a consumer? That means that you know that you're going to be getting comprehensive coverage. And you'll be also able to choose from a variety of plans in your area from leading health insurance carriers in Massachusetts. Now, exclusive to the Health Connector are what's known as health plans with advanced premium tax credits. This is the way that people are able to save dollars on their monthly premium. So people, as you're going through the application, the system is going to determine if you qualify for tax credits, and those tax credits reduce the cost of the monthly premium. Now, we also have a program known as Connector Care. So people who are in lower income ranges and meet other eligibility requirements can qualify for a low or no cost health insurance coverage. And these are great plans, no deductible, comprehensive benefits, low copay. So we can't say enough about these plans. So what I want to just let you know, again, just a few more details about how you could potentially get savings through the Health Connector. So I mentioned advanced premium tax credits. I mentioned that they lower the premium amount that you pay each month. What happens is the IRS sends your tax credit directly to the insurance company. So you as the consumer don't have to, you don't have to figure that out. You just pay less each month. And then as a consumer, if you have income, maybe that fluctuates throughout the year. And as an example, you're told that you qualify for $500 of tax credit each month. If you don't feel comfortable taking that entire tax credit, you could choose to take some. And at the end of each year, when you file your taxes, these tax credits get reconciled. So that is essentially how the advanced premium tax credits work. Now, for the Connector Care program, what's unique about this is that you are seeing even more savings. And the way that's happening is that we're using those advanced premium tax credits plus additional state dollars. And those two together keep the premium low that you're going to pay each month. So there are low premiums, there are low monthly bills for you, low out-of-pocket costs, no deductibles in the Connector Care program. And the way the Connector Care program is organized, there are different plan types that you could qualify for. And depending on which plan type you're eligible for, you could be paying as low as $0 a month or as low as $137 a month. So certainly there are slides at the end of this presentation that can give you more detail, but you can also go to our website, mahealthconnector.org, and get more details about the program, about the Connector Care program. And I've mentioned some of this already, so I won't, go through this in a ton of detail other than to say the Health Connector is the marketplace. So it is the only place where someone can access state and federal subsidies. And if someone isn't eligible for the Connector Care program that I was describing, you might find out that you're still eligible for advanced premium tax credits that lower your bill. So as I mentioned, there are different plan types in the Connector Care program, and here you can see the breakdown in what the lowest cost plan is would cost someone in that particular plan type. Now, in terms of applying or updating your application, Elizabeth went through a number of these details, but really I just want to serve as a reminder. Someone can apply or update their application online in English as well as Spanish. You can update your application over the phone, and that's with the help of customer service, either MassHealth or the Health Connector, or you can get the help of the community partner organization or health center. Please, please, please remember that there is one application, one online application if you are under 65 to help you find out if you qualify for coverage through the Health Connector or MassHealth. Because of that, you will get letters in the mail from both organizations. So we don't want to, confuse you in any way other than to say that, we're legally required to do that. And earlier in the presentation, Elizabeth showed you the screenshot of what our landing page looks like. So really, we encourage you to use the links that we send in our follow-up email, because we have heard sometimes people will do a Google search for Health Connector coverage and they end up somewhere they don't want to be. So certainly do use the links that we're providing you. In this slide here, again, just a reminder of things that we've covered, that Elizabeth has covered, but also here to provide you more phone numbers, more ways that you can get support. So for Health Connector customer service, the number is listed here, and that's 877-623-6765. If someone needs TTY support, the number is 877-623-7773. You can go to the Health Connector's website, and as Nuri had mentioned earlier, we will be sending you this presentation so you'll be able to quickly and easily get to all these links. And you can look at the Health Connector hours of operation. So outside of open enrollment, if you call the Health Connector, you want to call between the hours of 8 and 6 p.m. And Elizabeth mentioned that, we are out in the community. We are doing events. There are, staff from community organizations, people from Health Connector. Like it's, we're trying to do as much as we possibly can to be supportive during this time. So if you want to look up any local events, I know that this list is being populated every day. So certainly don't hesitate to check out the link to the local events. And of course, reach out and talk to one of our community partners. Elizabeth spent a good amount of time talking to you about navigators and certified application counselors. They're great. They're here to help you. We highly recommend you make an appointment so you don't have to wait, and they're able to help. Now, if you want assistance in a language other than English, you can click on this link here and do a little searching and see if you can find a navigator or a certified application counselor who speaks the language you would prefer to have your appointment in. So just a couple of reminders here. Please don't forget, if someone has lost, access to MassHealth coverage, they can still get health or dental coverage through the Health Connector. If they don't have access to another type of coverage, someone should update their application to find out what plans they qualify for and if you can get some additional savings. We do offer coverage for individuals, families, and small employers. I just kind of skipped over the small employer part, but if anyone needs any information about our program for small employers, you can go to our website. We have webinars on a regular basis to help explain Health Connector for Business. But first and foremost, we're here to help those people who may be moving on, transitioning from MassHealth. So what you need to know is if you in fact become Health Connector eligible, you would need to choose your plan, enroll in your plan. If you owe a monthly premium, you're going to need to pay your first monthly premium by the 23rd of the month before coverage can start. So really important, Health Connector coverage always begins on the first day of the month. So as an example, if somebody was trying to enroll in coverage that started July 1, they would need to pay by June 23rd. And that essentially, that structure is in place all year long. You can apply for coverage online, over the phone, with the help of customer service or with the help of an assister through our community partner organizations, or you can attend an enrollment event. So really, we encourage you to, if you need support, to call today and make an appointment to get help. So with that, I think we're ready for questions, Mary.
Perfect. Thank you, Nikki and Elizabeth. We do have a couple of questions here about the application and the process itself. So why don't we start with, if I am someone submitting a new application, so renewals aside, what is the waiting period once I have submitted my application to get a response? And can you just talk about what the process would be if I have to go back and update my income to reflect that I am on unemployment benefits, for an example?
Elizabeth, why don't I start and then certainly pass it over to you, because I think we have some different. So I will go with the simplest scenario and say, if someone is under 65 years of age and you want to submit a new application, you can do so online. And we shared the link for that, and you can, create an account, submit all of your information. The great thing about this application is if you're in that situation, you may get, it probably takes, depending on how large your household is, at a minimum, like 45 minutes to get through all of the questions. And you will see an automatic response. You'll see what in fact you are eligible for. Now, for Health Connector coverage, if you are eligible for a Health Connector plan, the next steps, you're going to need to shop for coverage, choose the plan that you want to enroll in, determine what the premium is. And if you have to pay a premium, you need to pay that by the 23rd of the month. And then coverage will begin on the 1st of the following month. So payments must be received and processed by the 23rd of the month in order for the coverage to be available to you. So I took you down the Health Connector path. So I want to hand it over to Elizabeth because I know things are different depending on someone's age and how they submit the application.
Definitely. Thanks, Nikki. For folks who submit their application online or by phone, you should get a determination quite promptly. If you submit via mail or on paper, we try to turn those around as quickly as possible, but it typically takes a little bit of time to process those through our systems. In either case, the result that you'll get from that application is either an RFI, meaning we still don't have enough information from you, or you will receive a notice letting you know what coverage you are now eligible for, and if applicable, how to enroll in a specific plan.
Thank you. So the next question that we have here says, if an individual sees that there is an unexplained or unexpected change on the account, so for an example, if they've had a carrier change on the application and they didn't receive a notice, but they just saw that once they logged into the portal, what should be the next steps there for an unexpected change?
Yeah, I would say on the MassHealth side, if you ever have questions about your coverage or your benefit, you should certainly call MassHealth. If you can also reach out to like those same resources, you can reach out to a certified application counselor, a navigator, you can go to enrollment center, you can call our contact center. But that would always be the best path if you have any questions.
And absolutely agree with everything Elizabeth said. You can also, if you're a Health Connector member and you saw something change unexpectedly, certainly contact customer service. And they'll be able to help you kind of just see what and why things had changed.
Great. So what if there is an individual in the household who is over 21 years old and is not making a lot of money? How do they know whether or not they should apply for MassHealth or the Health Connector?
So if they are that age, they should certainly apply. It's a shared application. So depending on their eligibility, they either will be told they have MassHealth or they will be referred to the Health Connector for their options there.
All right, and going back to, continuing with questions regarding the application process and the platform. So what do you guys advise for someone who has a duplicate account and they are getting an error message when trying to log into their HIX?
Okay, so this is why I cautioned you. So if you have a duplicate account, if you're experiencing that, you can call either customer service center. And this does happen. And that's why we really try to encourage people to use the forgot username or forgot password. But it does happen. And if you call customer service, they can work to have it fixed. I don't believe that it is an immediate fix because they need to do a little bit of research to ensure that they are removing or merging the accounts. But certainly either customer service center is able to assist with that.
Thank you, Nikki. And Nikki, would you mind reminding everyone of the deadlines for premium payments?
Yep, absolutely. So for Health Connector coverage, if you owe a monthly premium, it is always due on the 23rd of the month before the start of enrollment into the plan. So for example, I know we use June in the slide presentation, but what today, it would be due August 23rd, coverage would begin September 1. So just, keep that in the back of your mind. If somebody made their way to this webinar, I know someone earlier had asked about unemployment benefits. I think it's really, really important for people to know that if you are making your way to the online application and you've just been laid off and you didn't get a lot of notice, because sometimes it happens, people will get laid off and it happens after the 23rd of the month, call customer service, our customer service, whomever, and say, no, I explain that you just lost access to coverage, and they can help you process your application and get you into Health Connector coverage for the first of the month, if in fact you qualify for Health Connector coverage.
Thank you, Nikki. So what if I am the head of household and I have a spouse and children, but I have now lost my job? Will my spouse and children fall under the same health coverage plan that I have, or will they continue to be on a Health Connector plan, for an example? I guess talk a little bit about mixed households.
Sure. I'll let Elizabeth start.
What I was going to say is the best thing to do in this scenario is to update your information based on your income and any other income that might be in your household. And based on that, because we have a shared system, it'll determine whether you and your family are eligible for MassHealth, or whether some of you may stay on the Health Connector and some may be eligible for MassHealth. Nikki, what did I miss? What would you add?
Nope, I agree.
And then when submitting additional documents, whether it's to the Health Connector or MassHealth, well, in this case, it'll be the Health Connector, and they're being asked for a proof of income, which documents can be submitted as a proof?
So we have a comprehensive list on our website. I can, while we go on to the next question, I can search and put that in the chat. But I think it might be helpful to probably plug that we have a really great guide that both the Health Connector and MassHealth share. It's called Getting Started, and it will take someone through not only what is acceptable for income information, but what is acceptable for residency, what is acceptable proof for, identity. Whatever it is that you may be needing to prove. So I'll share that link. And also, if someone doesn't have income and they need to submit an attestation form, we also have those types of things. So I will share that momentarily.
I popped it in the chat for you, Nikki. I was multitasking since you kindly answered.
There you go. Thank you both. And then can we just take a moment to discuss dental coverage? So in the case that someone is covered by, let's say, a parent's medical plan, but does not have dental, are they able to apply for dental coverage only?
Yes, that's a great question. And I think it's really important to note, if somebody is going, like if someone's going through the application and they get health insurance coverage, they can also pick up dental coverage at that time. But if someone's getting health insurance coverage through a parent, or let's say someone is over 65 and wants to buy, and they're on Medicare and they want to buy dental coverage, they can do that. So if you just want to buy dental coverage, the fastest way to do that is calling Health Connector customer service, and they can help you with that over the phone.
Thank you, Nikki. And Nikki, do you mind sharing a little bit more information about the different tiers? So specifically, if benefits differ depending on the level that they are enrolled in. So silver, gold, do they have equal co-payments, limits, etc., or do they differ?
Yeah, no, thank you. So I think within this presentation, we were primarily focused on talking about connector care plans. But if someone is, just shopping for health insurance coverage through the Health Connector, what I would recommend them to do is start with our Get an Estimate tool, and that is available on our homepage. And when you are going through the shopping experience, and if you're just browsing through plans, you'll see that the plans are grouped into different levels. They're grouped into gold, silver, bronze, and typically the way this is structured is that your gold plans are going to be more expensive than your bronze plans. That is the way, kind of the way you can think about this. Now, the reason gold is going to be more expensive is because there's more premium payment and less copay for you. And then if you kind of bought a bronze plan, you could get a lower cost plan. But when you, at point of service, when you go to use the coverage, you will be paying more out of pocket. I don't know if I did a decent job describing that, Nuri. Did that somewhat make sense? Because what I was going to say, like, every benefit tier has what's known as an actuarial value. This is probably something you guys don't want to know, but it is a percentage, and it's the percentage that the carriers pay versus what the consumer pays. So I hope that wasn't too wonky and as simple as I could make that.
Yeah, that makes sense. And again, if anything, I would always, I mean, as you guys have mentioned already, recommend folks call the call center, customer service center, if they have any more questions specifically about each tier level and the benefits. So yeah, thank you, Nikki. Switching gears back to the MassHealth redeterminations. So what if I am a member of the Health Connector, a Health Connector care plan, and I received a blue envelope? Do I need to complete a renewal form? Would it be a renewal form for the Health Connector or MassHealth? Can we just clarify again the differences between the Health Connector and MassHealth and the blue envelope process, Elizabeth?
Of course, individuals who receive the blue envelope should respond. This means that the individual was on MassHealth and may be eligible for it, and certainly should respond and provide their latest information. This scenario sounds a little tricky, where it sounds like maybe they were on the connector but got the blue envelope. I'd certainly recommend they call MassHealth customer service to get their questions answered. But in general, if you receive a blue envelope, this means you are selected for your renewal as part of MassHealth and should respond by the deadline.
And Elizabeth, let's say I do go through the renewal process. Do I need to update anything under like my current plan, or does that remain the same?
Yeah, if you're currently enrolled in a health plan through MassHealth, assuming your coverage stays the same, you will not need to re-enroll. So you should just need to respond to the blue envelope, provide your updated information.
Thank you. And can you remind us, Elizabeth, the timeline of the blue envelopes and when they need to respond? How many days would that be?
Yeah, of course. When individuals receive their blue envelope, they'll have 45 days to respond. That date will also be listed in the blue envelope, in the form inside the blue envelope.
Thank you. And how can I get more information about access to free translators?
It's a great question. Individuals who need or would like translation services to support their notices can call the MassHealth Contact Center. We have a number of agents who support in different languages, and we also have access to that translator line where they can bring a translator on the phone in live time to provide that translation service for almost any language.
Thank you.
Nuri, while you're pulling up the next question, I just want to say that the same is true for Health Connector. If you call the Health Connector customer service, if they don't have staff who are able to assist you in the language that you need, they will reach out to a translation line for help.
Okay. Oops. Sorry, I just lost the next question. Okay, so we have a family who is enrolled in MassHealth, I guess since the beginning of this year, and this person was just wondering if they are all set for enrollment for next year, or if they have to do anything, any action items in order to keep their coverage.
Yeah, this is a great question. So every year that someone's on MassHealth, they will need to go through this renewal process. It sounds like from this question that the individual applied for MassHealth and was enrolled in January or so. This means that most likely this upcoming January, after they've been in MassHealth for a year, they'll receive that blue envelope and will need to complete their renewal to remain eligible for MassHealth.
Thank you, Elizabeth. I'm still working through the questions, making sure we cover them all, but if there are any other remarks that you guys would like to share in the last 4 minutes that we have here with folks, welcome those thoughts.
I see a few questions, Neri, about what should I do in like my specific situation based on like who I have in my family, or I have questions about what coverage I might be eligible for. I would say if you have specific questions, I would really encourage you to either reach out to our contact center to find a MassHealth enrollment center in your area, or find a certified application counselor or navigator. Those folks are going to be able to talk about your specific situation and what you might specifically be eligible for. For individuals who are maybe confused by some of the tiers or different program options, Nikki, I don't want to step out of line, but I would encourage them to first apply, find out what they're eligible for, and then from there, folks are available to help them shop for their plans and figure out which one's right for them.
Absolutely, thank you. And then there's one other thing that I wanted to respond to. I scrolled through quickly and saw something that stood out to me. If someone recently lost employer-sponsored insurance and now is considering COBRA, the Health Connector is a great alternative to COBRA. Typically, people find that they can enroll in plans for a lower monthly premium. And as I said before, Health Connector offers comprehensive, Health Connector coverage. All the plans are qualified health plans, so you can rest assured comprehensive coverage. So again, just either reach out to our customer service center, go online, apply, or reach out to a local partner, and they can help you get through the process and help you find something that is going to meet your needs.
And one last thing I'd also flag, for individuals who receive a notice that they've lost MassHealth coverage and they didn't respond, or maybe they didn't know they had to take action, it's really important to remember that you might still be eligible for MassHealth if you receive this notice and hadn't completed your renewal. So if you're in that situation, or a friend or a family member is, then you should certainly reach out and call our contact center. They can figure out if you're still eligible, and depending how long ago you lost your coverage, you might be able to have your coverage reinstated back to the date that you lost coverage. So if you're not sure, give us a call. Folks are standing by and ready to help.
Thank you, Elizabeth. And should folks only expect to receive one blue envelope during the renewal process, or multiple blue envelopes?
For the most part, folks only receive one blue envelope for the year.
Great.
And Nuri, just one last thought. I saw that someone had mentioned getting this PowerPoint, etc. Just a reminder that we're going to be sending an email to everyone, and that email will have the presentation as well as a link to the recording.
Thank you for the reminder, Nikki. All right, and I do see that we are out of time now. So we want to thank everyone for joining today's webinar, from everyone at MassHealth and the Health Connector. and all of the assisters across Massachusetts. We thank you all for joining and we wish you well. Enjoy the rest of your day, everyone.